Today we're going to discuss arthroscopic rotator cuff repair for rotator cuff tendon tears around the shoulder. Often rotator cuff repairs are performed when the tendon pulls away from the bone inside the shoulder. Surgery can be performed which will allow a repair of that tendon back to the bone without making a formal incision on the shoulder joint. The surgery often begins with a diagnostic arthroscopy. Arthroscopy means a small working portal that allows a camera to be placed inside the shoulder joint. During arthroscopy of the shoulder, while we're looking inside the joint, we can evaluate the ball and the cup and other tendons that then go around on the ball and cup. Oftentimes we'll make a small incision on the side of the shoulder, once again allowing our instruments to come in from the side through a very small incision, and this will allow us to repair the tendon back to the bone. We'll place arthroscopic anchors, which is a small metal or absorbable device that has suture affixed to it in the bone. Once the anchors are in the bone, we're able to use other instruments to help facilitate pulling the sutures through the tendon. Once all of the sutures are through the tendon, we use a very specific kind of knot that allows the tendon to be pulled over to the bone and then affixed onto the bone, with the anchor being the area that the suture is tied into. You'll see often another set of sutures that we will use to help bring the tendon back together either before or afterwards to help augment the repair back to bone. It's very important to get the tendon to be mobilized, and that means to make sure the tendon can get all the way back to the bone, especially in a chronic situation where many times it is pulled far away from the bone and needs to be allowed to return back to its bony base. When we're finished with the procedure, the small portal sites often require either no or just one small suture, and often these sutures can be absorbable so that the patient doesn't have to have any suture removal at the time of their postoperative visits. We also apply dressings to the shoulder and place them into a sling to protect our repair during the early recovery phase. Both the size of the tendon tear and the chronicity, or the length of the time it has been since the tendon tore until it is repaired, helps us to plan for who may be good candidates for arthroscopic intervention. The recovery time for repairing the tendon back to the bone is equivalent whether it is arthroscopic or whether it is a formal open procedure. However, many patients will describe much less discomfort after the arthroscopic procedure. Also, the arthroscopic procedure allows for a more cosmetic look to the shoulder once a full recovery is obtained.